And so it gives me great pleasure to introduce our four speakers in this first session, called How Health Looks Now, Views from the CogX Editorial Committee. Welcome, everybody. I think I have to do this in a very specific order because there may be some splashes with particular names and photos that come up. If not, just wave. First, in my top left, is Tina Woods. Hi, Tina.
Hello.
Thank you very much. Thank you for bearing with me and us and everyone else in the last few months for all the backwards and forwards. Secondly, we have Maxine Mcintosh on my bottom left. Hi, Maxine. How are you?
Hello.
Good morning. Dina Radenkovic, who is a doctor at St. Thomas's Hospital, who has been working at the front line and also in a lot of the science. And Chris Wigley, hi Chris, top right, there we are, who has been working as the new CEO of a small thing called Genomics England that is quite important for our futures. So we have people who here who have been involved quite deeply in policy, in science, in medicine, and in technology, both before and after these recent events with the pandemic. But clearly, the pandemic has changed what it is that we have done and how we see the world. So the first thing that I'm going to do is a challenge, I think. I would love you guys, as our editorial committee, to each one by one, in that order, Tina, Maxine, Dina, and Chris, if you don't mind, you've got 30 seconds to introduce yourselves from how on earth you got from being born to where we are today on this stage, and just if you can, how has your life changed in the last 6 months since January 1st? First of all, Tina, over to you.
So just very, very briefly to introduce sort of who I am and the hats that I wear. So I wear a few hats, have been doing a lot of work with the in the private sector, academic health science networks, NHS. I work with Innovate UK on the Aging Society Grand Challenge. I run the All-Party Parliamentary Group for Longevity. We launched the Health and Nation Strategy actually in February with the support of Matt Hancock. And so lots of things happening in the last few months. But of course, you know, since February, which is actually when we launched our Health and Nation Strategy for the All-Party Parliamentary Group, you know, obviously so much has changed. And obviously I'll speak a little bit about that, you know, in due course over this session. But I mean, personally, I think, you know, I'm very, very lucky. I haven't personally been badly affected by the crisis, or indeed, you know, close relatives or family members. So I've been very, very fortunate that way. I think a few things in terms of my personal life have been affected. You know, I'm spending a lot more time actually with my family. I've never been more connected with my family, and they live all around the world. So that's a really, really positive impact. I've been incredibly productive with my work, just because, you know, just being at home, obviously with your laptop, you know, it kind of allows you to be even more super efficient, you know, having to travel, all those sorts of things, which are pretty obvious. I think the other thing too is my fitness regime has changed. I never hated running, but I've now found myself running and doing yoga, and the rowing machine that sat in the cellar is now being put to good use. And I now actually use my smartwatch. So lots of things, but I think, you know, fundamentally, you know, obviously a lot of things have changed. I was supposed to come out with a book in April. It had to be delayed until September. So that's out on Amazon now, Live Longer with AI. Of course, you know, the pandemic, this wasn't the right time to come out with in April. We've had to change the whole focus, you know, in terms of the lessons and legacy from COVID. So that's, you know, so lots of things have happened, but not necessarily negative things. Anyway, I'll stop there.
Wonderful. Welcome, Tina, and thank you again for all the work on making this next 3 days an exciting lineup. Who's next? Maxine.
Hi. So yeah, a lot has happened for me since January. So in the new year, I was out in Indonesia working with the WHO on Indonesia's AI strategy, just as COVID was starting to break. So it's kind of really interesting to see how a government with which was so distributed was looking at how they were going to bring together lots and lots of federated and fragmented data sets. And so when I came back from Indonesia at the end of February, I then started a postdoc, and obviously that was the point at which then COVID massively started to kind of hit the UK, and then it's been a whirlwind of kind of chaotic projects coming together, breaking apart, new collaborations. So that's been my kind of last few months. So I currently work as a postdoc between the Alan Turing Institute and the Health Foundation and the Statistics Department in Oxford. And I'm also the co-founder of an organization called One HealthTech, which operates as a grassroots community to support better diversity and inclusion in the field of health tech. So obviously at the moment, given the current climate, this is a really, really important group to kind of be listening to at the moment. And I've certainly learned a huge amount from understanding and hearing people's experience, certainly from like an intersectional perspective, about those who are maybe from more deprived areas or who are Black and ethnic minorities, how they're currently experiencing COVID and obviously experiencing the current protests. And so that's been a real kind of eye-opener to listen to the community that I'm very fortunate that I was kind of contributing and bringing together. And I guess personally, it's been a bit mad. I was meant to elope to Russia. That hasn't happened. I'm doing a big building project. Not a good time to be destroying and rebuilding a house. And my partner and I also got separated during lockdown at opposite ends of the country. So he was in Edinburgh and I was in London. So that was kind of quite sad. But some of those things have been rectified. But we still haven't got married. I think it's probably the maybe sad outcome of the last 6 months.
So why Russia? I mean, I eloped to Las Vegas, which is quite the opposite end of the earth, when I went to my drive-through. So why Russia?
I don't know. I think we had this like romantic idea of just like eating loads of steak tartare and vodka, and like the hotel rooms with gilded gold rooms for kind of £80 a night just seemed like quite a fun place to go. So that's kind of why. But I have to say we didn't think about it very carefully. I think we were both experiencing pressure from our parents, so this was probably a kind of response to saying, well, if you want us to get married in a church in the Cotswolds, like screw you.
You can get all of that in Vegas, by the way.
And Vegas is one of the few places that's now reopened, so maybe that's going to be plan B.
I know. The future is wide open for you there, Maxine. Brilliant. And thank you also again for all your hard work. Dr. Dina.
Hi, Jack. Thank you for introducing me. So my name is Dina Radenkovic, and I'm an academic doctor at King's College in London and Guy's St. Thomas's Hospital. I trained at UCL and Harvard and worked a bit in digital health before. So my experience is slightly different. Firstly, I had big plans for this year. I was speaking at the World Economic Forum end of January, talking about biological aging and how we're going to reverse it and live happier, longer lives with better healthcare than we've ever had. However, we did have to change the plans. So I had the pleasure to work on the front line and help with the NHS COVID response at St. Thomas's Hospital. I have switched a lot of my research projects towards COVID and have a pleasure to co-lead two large clinical studies and also a clinical trial with wearable technology for healthcare workers. Unfortunately, my fitness did not improve during this pandemic because I did catch COVID, and it was quite a rough few weeks, and I'm still dealing with the fatigue, and I have this bike behind me, but I haven't used it much. But I do think that it's a really an exciting time being a doctor, because you could really make more impact than ever probably, and it's a great time because of the great challenges that we have to really use innovation to solve some of the big problems.
Thanks, Dina, and thanks for all your work helping us learn about how this is going to affect people long term as a condition, as opposed to just simply dealing with it on the front line. Chris.
Yeah, thanks. So June 77, Vancouver, was when I was born. More recently have been co-leading a company called Quantum Black, which built machine learning applications for various folks, and just took on the role as chief executive at Genomics England in October. So we're still reasonably new in role when the COVID crisis hit, and like many of the group, like many other folks, we've pivoted pretty heavily to really dial up our response there. So we're involved in launching a major human genome sequencing program to try and understand the why behind some of the correlations that we can see around age or comorbidities or other conditions. And in terms of my own life since the crisis began, I've become a lot more hairy. And so, what is healthcare like now? It's pretty hairy around here. And I've also just finished an 8-week secondment to NHSX, working with Matthew Gould and friend of the fest, Dr. Indra Joshi, on standing up a lot of the data elements in the response to COVID-19. So intense and hairy.
A very big change to what we were doing all before. I just before this whole thing kicked off, I was doing a rather silly thing. I was traveling around the world, as I tend to, but just in a slightly different way. I was the doctor on the 7 on 7 in 77 challenge, which I don't know if you know what it was. It was 7 marathons on 7 continents in 77 hours. The previous record was 118 hours. And this was with the guy who was the exec producer of the Game Changers movie, a young, brilliant tech entrepreneur called Carl Vode, who wanted to show how you could do something like this with or without a doctor like me on board, on a totally vegan diet. And I remember starting to model out the number of cases outside of Wuhan province on my laptop. I think I started building the model on my laptop just as we were taking off from Antarctica, after the first marathon. And I realized at that point that my life would change, because I knew it would be one of the very last plane journeys I was going to take for a very long time. And I have to say that it has been probably the biggest change is the isolation for myself, and yet paradoxically the connectivity with so many more people. And that is just something I'm still amazed about, is how connectivity, when you're sitting in one place, can actually bring you together with people, as hopefully we are with I imagine hundreds if not thousands of people listening into this who otherwise wouldn't be able to travel or attend and listen to what we've got planned for the next 3 days. Before I ask my last question, and we've only really got a few minutes each, but each of you, what do you think is the highlight that you're looking forward to, the speakers that you're looking forward to hearing from over the next 3 days? Let's go backwards. Chris, what about you? And you're not allowed to say yourself, Chris, I'm afraid.
No, absolutely not. I've got lots of things to look forward to. I just mentioned Indra Joshi, who I've been working with at NHSX. Really looking forward to her talk. Alexandra Musavizadeh from Tortoise Media is doing a piece on AI and where we're going in those directions. Too much to look forward to.
Thank you. I'm looking forward to the Indra piece too. Absolutely. Let's go backwards. Dina?
So obviously, because I'm biased and because of my research in aging and preventive medicine, I'm really looking forward to Tina Wood's session on aging, and to hear my colleagues Tim Spector and Nir Barzarali. And again, Maxine is doing an amazing session with Ben Goldacre, and you're doing it with Hugh Montgomery, who's my old professor at UCL. So I can't wait to hear these sessions.
Well, very, very sadly, we won't be joined by Hugh. That's something which, unfortunately, it's been in the news. But sadly, our very dear friend Professor Hugh Montgomery lost his son in a drowning, lost at sea. So I'm very, very unfortunately, one of our dear friends and one of the people who's really been at the very, very front line of the COVID response nationally, locally, putting his neck on the line from the very beginning, has had a serious family tragedy. So yeah, my heart and all of our I think words of condolence go out to Hugh and his family at this difficult time. But yes, it was very, very sad. But we have some great sessions around those topics, which I think will do honour to Hugh and his service to this country. Maxine, how about you?
I'm sorry, you've slightly taken me aback. That's so awful. He was also one of my professors at UCL. Oh my gosh, poor man. Oof. I guess the sessions I'm looking forward to are, I suppose the thing I care about a lot is the social determinants of health. And I think one thing that COVID has done is that it has exposed that everything has a relationship with COVID. Therefore, every single bit of society has a health tilt to it. So I'm really looking forward to going to the non-health stages and seeing what their take on COVID is. And I guess a kind of like quite specific technical thing is that I'm really looking forward to a session on causal inference today at 5 p.m. At the iron stage, because as I'm sure we're all very aware, like AI and statistical modeling is very good at giving you lots and lots of spurious correlations, but telling you why and in what way different things interact to predict or classify things is something we don't know very well. So the causal inference session at 5 p.m. is definitely the thing I'm looking forward to the most.
Excellent. Believe it or not, you'll love to know that I'm actually going to rewrite an author on a paper of something I really don't know a lot about, but it's a brilliant paper. It's a brilliant journal called Neural Inference Models, which I've never heard of. Have you ever heard of the journal Neural Inference Models? No, I'm not sure how my name got on that paper. But anyway, you can tell me all about it afterwards, Maxine, after I'm supposed to have written it. Tina, how about you?
Yeah, I mean, there's a few sessions that have already been mentioned, Ben Goldacre, and of course I know Indra very, very well, so we'll be following that. But like Maxine, actually most of my interest is very much actually in many ways non-health related. It's actually the wider impacts on our health environment, things like that. So I'm going to be taking a keen look at sort of the planets and cities, and I actually, with all the work that I've been doing with the last year or so, it's the whole interconnection between health and the planet. So I think that's really, really interesting. So actually, I'll be catching a few of the other sessions. So that's my answer.
Great. I'm looking forward to all of those that you've mentioned. I'm also greatly looking forward to speaking to my good friend Mark Koska later on this afternoon on immunizing Earth, which I think is an interesting topic beyond the science of vaccinations, but actually how it is that we can produce, distribute, and make sure people don't steal the vaccines that we're supposed to give to others. It's going to be a fascinating topic, which I can't wait to hear about. We've only got a couple of minutes before we actually kick off with the whole show and the real stars, who are our guests that we've invited. But before we go into that, I just would wonder, maybe we should close each with, what do you think CogX 2030 is going to be like? This is 10 years from now. What's the one big thing that you reckon is going to be significantly different when we open CogX 2030? I'm going to do random here. I'm going to go Dina first.
Well, I'm a very kind of slow thinker, backbite evidence, very cautious with my dreaming and speculations. But I guess I was going to rephrase the question, probably saying what I think is going to be the biggest change from all of this. And then I'm hoping that we go incrementally and just continue to improve. But I definitely think that from this COVID crisis, probably the biggest winner is going to be telemedicine. And I think that we have a unique opportunity to reopen our world into a world which is with a much greener economy, where people have higher quality of life. They spend less time commuting, polluting, and spend more time with their family, exercising, widening some of these positive changes that we've seen during the pandemic. And I think that with truly integrating technology, but not solely for the means of communication or chatting to your doctor through app, but the way we diagnose and prevent disease, that we can have a healthier society with increased longevity, so increased healthy life expectancy by minimum 5 to 10 years for everyone, not just the selected groups.
Real quick, guys. One sentence from each of you. What's going to be different? What's the biggest thing that's going to be different, do you think?
Should I piggyback on what Dina said? So yeah, so I think I hope by 2030 or 2035, which is the mission of government, to increase healthy life expectancy by 5 years. But I hope, if nothing else, this crisis will encourage all of us to think of our health as our greatest asset to protect. It's so linked with the wealth of all of us as a nation. But I also think I hope next year, by 2030, we'll have far more people from all walks of life checking into CogX, because I always worry about echo chambers, tech echo chambers, all the rest of it. So I just hope, by then, we'll have much more engagement with the broader base of, all citizens, and see this, all of us in it together.
Thank you, Tina. Max, you always surprised me with the tangential thinking that we ought to have in the front of our minds most of the time. What is the biggest tangent that you think will fork from right now and take us into weird places into the future?
No pressure. No, I mean, CogX is an AI festival, and I'd hope that in 10 years' time, we've kind of moved on from the conversation and the types of questions we're asking around AI, and that's part of an integrated life. And we've moved on to the kind of next new big technology as far as the CogX discussion goes. But as Tina says, I think that the internationalization of this is a really important thing. You know, lots of AI conferences have really been put under the cosh for not having specific representations from specific geographies around the world. So it'd be great to kind of see more people from Latin America and from Africa contributing to this conversation.
Chris, apart from the way that we will use tracing apps to hack our way into finding new dates, no, that's not true. How is our life going to change immeasurably?
Well, I'm supposed to be representing the voice of tech in this group, but I'm going to start with something very non-tech, which is that I hope that in 2030 we are all actually in person and able to have a drink together or high five together or hang out together, which would be great. And on the tech front, I think 10 years and a lot of focus, we've shown in the last few months what can be achieved at really high speed in technology and data and healthcare. I would love to think that in 10 years' time, we could be having a conversation about how we've actually fixed a lot of the basics in data and healthcare in the NHS, and that we've really brought the public along with us, listened to their views, and kind of had this national dialogue about data and technology, and that's enabling this whole new vision that we all have around personalized and predictive healthcare. And I think everyone at CogX 2030 will have a different relationship with their genome.
Absolutely. Thank you very much, guys. Appreciate hugely the efforts that you guys have put in, both in your working life, in your voluntary work, and for making pulling this program together with the CogX crew. All that's left for me to say is that we have now a meet the speaker. I've got to get this right. If I don't get this right, I get sacked. So it is meet the speaker breakout stages. We have that for those who are priority pass holders. And that is the Q&A session that Maxine Mcintosh here is going to be chairing. And that will be beginning very shortly. For us, the rest of us, you can join us back here in about 3 or 4 minutes' time, where we will be hearing accounts from inside the ICU from one of the UK's leading respiratory consultants and academics from Imperial, Dr. Matthew Hind, and his patient who went through quite an extraordinary experience under the care of the folk at the Brompton. So thank you very much again, and join you back here in a couple of minutes' time.
Want access to more CogX videos? Subscribe now for free at cogx.co.